In this video, I'll talk about how to approach a case of fatigue in the long clinical consultation of the MRCP PACES exam. I've also covered back pain, diarrhea, vision loss, seizures, and you can find them on the LCC playlist available on the channel. Okay, so let's begin. Fatigue comes up in the exam quite often, and all the underlying conditions are really important and they're very high yield. They come up in our daily practice and in the exam as well. So the patient can present with fatigue or tiredness or weakness. So whenever the patient mentions weakness as the presenting complaint, be it the main complaint or if it comes up in the systemic review, you need to establish whether it's muscular weakness with a reduction in power of the muscle groups or whether it's tiredness meaning fatigue. So whenever the patient says weakness, ask what do you mean by weakness? Is it tiredness or do you have difficulty in doing your daily activities? So elaborate it before you go on. So these are some of the potential conditions that can come up in the exam. You can categorize them into separate systems. For example, the most important one would be endocrinological causes such as hypothyroidism, diabetes, OSA, or adrenal insufficiency. Secondly, it's important to rule out tiredness or fatigue due to anemia, for example, iron deficiency, or maybe macrocytic or anemia of chronic disease. This has to be kept in mind so you can rule it out during the history if the patient is experiencing any blood loss or if they have any comorbid conditions. Musculoskeletal conditions including RA, SLE, PMR, polymyositis, and such. For CNS causes, think about myasthenia gravis and Parkinson's. Important to rule out drugs such as antihistamines, sedatives, antidepressants, or alcohol use. And functional conditions or psychological conditions such as chronic fatigue syndrome, fibromyalgia, or depression. Also important to rule out malignancy. Okay, so I'm not going to go into much details. It's going to be a brief overview. After the initial history-taking pattern, the introduction, permission, and exploring the main condition, exploring the main symptom, we go on to the specific questions that are going to narrow down our differentials. The first thing would be to establish the timing. What time is the tiredness or what time is the fatigue burst? So candidates ask about timing to rule out myasthenia in specific. If the timing is worse in the evening, if the fatigue is worse in the evenings, it's myasthenia. Think about the morning too. So if it's worse in the mornings, think about Lambert-Eaton myasthenic syndrome or OSA. So you would then need to ask more questions to confirm which one of these is the main diagnosis. Next thing to ask is whether they're experiencing snoring at the nighttime or if they're experiencing daytime sleepiness. This is going to point towards OSA and OHS, so obstructive sleep apnea and obesity hypoventilation syndrome. There's a difference between the two and you should be aware of it. In OSA, like the name suggests, there has to be an obstruction. So it could be either due to being overweight and a wider neck circumference, or it can be due to maybe macroglossia. It can be seen in acromegaly or amyloidosis. In obesity hypoventilation syndrome or Pickwickian syndrome, obesity is mandatory. So OSA can occur without being overweight, such as maybe in acromegaly, but in obesity hypoventilation syndrome, obesity is mandatory to fulfill the criteria. In this is kind of like a more severe version of OSA. There will be more daytime sleepiness. There will be morning hypercapnia, which will be seen in sleep studies or ABGs. It cannot be established on the history. Besides this, you can then go on to the next question of mood. If the patient has been feeling low lately, think about depression, chronic fatigue syndrome, also hypercalcemia. So fatigue with mood disorders can point towards hypercalcemia, and that can be seen in maybe sarcoidosis or maybe malignancies. Does the patient feel refreshed upon waking? If not, think about both OSA and fibromyalgia. Also take a holistic approach and think about the patient demographic, male, female, young, middle-aged, old. So you can think about in younger females or middle-aged females, who are feeling depressed or stressed at work, think about fibromyalgia. Maybe a middle-aged man who's overweight, you can think about OSA. Although it's not a fit criteria, but the demographic can give you an idea of the underlying cause. Ask about polydipsia. Polydipsia, polyphagia, polyuria are all symptoms suggesting diabetes. The patient might not be a non-case, but these can be the presenting initial symptoms. You can establish this. Also, polydipsia can be seen in hypercalcemia of sarcoidosis too. So keep all the options open. Asking about muscle aches and joint pains. This can point towards RA, polymyositis, polymyalgia rheumatica if there's joint stiffness too. So at this point, you'll be direct it towards at least a category, and you can explore that more, ask specific questions about that. And before going to the systemic review, ask specific questions about thyroid symptoms, because hypothyroidism can present with fatigue. So ask about weight changes, appetite changes, and intolerance to extremes of temperatures. Next thing would be anemia. To establish anemia, you need to ask, besides tiredness, do they feel breathless on exertion? So that can point towards anemia. And if they do mention this, you can ask about maybe their diet. Are they purely vegetarian or are they vegan? Ask about any blood loss, maybe coughing up blood, throwing up blood in their bowel motions, dark colored stools. You can rule out anemia with this. Next thing would be then systemic review, quick screening of all the systems, and drug history. So this is basically it. These are the most common conditions that come up in the exam. So when you're done with this, the examination would be very relevant and focused too. So let's suppose you come up with a diagnosis of myasthenia. You need to tap into the myasthenia gravis routine, check the fatigability of the proximal muscle weakness, look at the neck, look for any thymectomy scars, ask the patient about any previous surgeries. If the patient is feeling fatigued because of hypothyroidism, do the neck examination of a thyroid examination scheme. If it's sarcoidosis, it's a multisystemic disorder. So you need to examine all the systems, but the priority will be given to the system that has any positive history finding. For example, if the patient says, I've been having cough or chest pain, examine the respiratory system first, and then the cardiovascular, and then the abdomen. So similarly, in the Viva, the differentials would be the most likely diagnosis first, and then anything that you have a doubt about. And the last would be something that you couldn't confirm just solely based on the history and examination, and you would need investigation. But it should be something that is important to rule out, maybe some kind of malignancies or any kind of vascular conditions that need to be ruled out immediately. So this is it. Also, in the Viva, the investigation should be very focused and specific. So if you're saying hypothyroidism as your main differential, you need to mention thyroid function test as opposed to maybe acetylcholine receptor antibodies from myasthenia. The specific investigation for your main differential first, and then others to rule out. Also, you can mention full blood count in this, looking for anemia, ruling it out, even if you don't find any history, symptoms, or examination findings. So you can mention a full blood count here. Also, urea and electrolytes. So this is it. I'm going to play a video now. It's kind of like a case presentation. Watch this, make the diagnosis or a differential in your mind as the video goes along. The answer will be given at the end. So in this case would kind of like signify that there's not necessarily just a one clear-cut diagnosis in many of the cases that come up in the exam. And in those cases, you will be marked according to a wide differential. So you need not get to the right singular diagnosis. You can mention a sensible differential as well. Okay, before we go on to the video, if you have an exam coming up, you can take the online mock exam. It's based on the real exam format. There will be 2 LCCs, 2 communication, 4 short stations. And after it's done, we'll have a discussion. I'll send you the feedback according to the RCP criteria. And if you want a one-on-one coaching session, it's a 10-day course you can have with me. In an hour, we'll discuss 1 LCC and 1 communication daily. And after it's done, the answer key and the personalized feedback will be sent to you. And if you want a crash course on communication, it's a 3-day session covering all the important categories of scenarios that come up. Okay, on to the video now. Thank you for listening.